Kazakh geneticists are uncovering the secrets of heredity.
I'm a mother of 2 children. My husband and I are planning for our 3rd pregnancy.
What abnormalities can early genetic testing detect?
The advantage of NIPT is that it doesn't require piercing the amniotic sac.
How does lifestyle affect our DNA?
New technologies now allow us to extract both RNA and DNA from small samples. Many cancer-related genes are damaged at the RNA level, not DNA, but RNA. I'm Mulder Oralbek, 31 years old. I'm a mother of 2 children. My husband and I are planning for our 3rd pregnancy.
Planning is the first step toward conscious, happy motherhood. As geneticists often say, like a mantra, early genetic diagnosis through DNA, chromosome, or metabolite analysis helps identify congenital diseases, hereditary mutations, assess disease risk, and choose personalized treatments.
Before, genetic abnormalities could only be detected by the end of the 1st trimester of pregnancy, but now I'm so happy that we can detect them at the planning stage. It's no secret, healthy parents lead to a healthy child. That's why my husband and I decided to take responsibility and check our health now to give birth to a healthy baby.
This is the first genomic laboratory in the country where diseases are studied at the DNA level, led by Kazakhstan's chief geneticist, Dr. Gulshara Abildinova. This lab is at the forefront of genetic research. With over 40 years of experience, Professor Abildinova interprets DNA like a book, helping people understand genetic diseases before they become life-threatening.
We treat patients with solid tumors, including those in the head, neck, stomach, or other organs. We also see patients with blood-related conditions. Let's say a young woman who's planning to get married or a young man gets tested and learns that they carry a gene linked to a serious condition. In such cases, the woman should have her partner tested as well. If he is also a carrier, we can then proceed with further testing once pregnancy occurs, including checks on the fetus. We have the technology to do this. At the end of 2024, we introduced a new testing method, non-invasive prenatal testing, or NIPT. We offer NIPT from the 10th to 19th week of pregnancy, with results available in 14 working days. The main advantage of NIPT is that it's non-invasive, meaning no need to puncture the amniotic sac. By 14 weeks, we can determine whether the fetus will be healthy or have a condition. If a problem is detected, it's up to the family to decide how to move forward. They can choose whether to continue the pregnancy or consider other options. This is a reproductive decision. As doctors, our role is to provide facts, explain the diagnosis, and offer guidance. But in the end, the family makes the final decision.
Today, Kazakhstan is home to 20 fetal medicine centers and 18 same-day clinics. At these centers, women in their 1st trimester receive ultrasound and biochemical screenings, along with genetic counseling, all in one day. These advanced methods help identify developmental issues, chromosomal and genetic abnormalities in the fetus. From 11 to 13 weeks and 6 days of pregnancy, multidisciplinary teams are in place to address any issues that arise. The goal of same-day clinics is to make these essential screenings and diagnostic services as accessible as possible for pregnant women across Kazakhstan. For those living in remote areas, transportation is provided by local authorities.
The specialists who diagnose fetal anomalies are held to very high standards. They're required to have FMF certification. It's an accredited international course that's available online and free of charge. This is mandatory and we'll continue to enforce that.
The laboratory now offers a prenatal test that can detect Down syndrome with 99% accuracy as early as the 10th week of pregnancy.
Currently, we conduct neonatal screenings for 2 conditions. All newborns are tested for congenital hyperthyroidism and phenylketonuria. If present, phenylketonuria needs to be diagnosed before the baby turns 1 month old. We have about 200 children with this condition, many of whom are already in school. They are thriving and fully integrated into society with no setbacks. Early intervention made all the difference. Children with congenital hyperthyroidism are monitored by endocrinologists, and we plan to expand our screening to include additional conditions.
Thanks to early genetic testing, the number of children born with Down syndrome in Kazakhstan has decreased over the past 2 years. At the same time, there has been an increase in the number of pregnancies terminated due to congenital defects and chromosomal abnormalities.
Kazakhstan is the only country in the post-Soviet space that provides all services for free. We offer free healthcare for pregnant women, including all invasive procedures. Even advanced DNA tests covering 5 chromosomes, which would usually cost more than 200,000 tenge, are done completely free. Ultrasound scans are also provided at no cost. Right now, there is concerted effort across the regions to equip hospitals with high-end ultrasound machines. These expert-level devices ensure that birth defects are clearly visible. Our goal is to detect defects in the first trimester up to 14 weeks, because diagnosing them later has a psychological impact. Once the umbilical cord forms between the mother and fetus, the connection changes. But if we detect it earlier, there is more time to make an informed decision.
Geneticists use NGS technology to diagnose nerve and muscle diseases, identify predispositions to diabetes, asthma, heart and vascular diseases, as well as assist in cancer diagnosis and treatment. NGS, or next-generation sequencing, is one of the most advanced DNA sequencing methods available today. We use it primarily for whole exome and whole genome sequencing, non-invasive prenatal testing, microbiome analysis, targeted gene sequencing for therapy selection, and many other applications. The main advantage of NGS is speed. In the past, DNA had to be read 1 nucleotide at a time, which made the process slow and labor-intensive. Even sequencing a small DNA fragment could take a long time. NGS, also known as massively parallel sequencing, works differently. The system prepares a chip containing thousands of tiny wells with special microspheres. DNA is loaded into these wells, and by changing the chemical environment inside them, the machine can read millions of DNA fragments at once. That's what makes the process so fast.
Молекул одновременно. То есть вот это и позволяет сделать быстрее, преимущество именно вот эта скорость проведения исследования.
Sequencing eliminates the human factor. Once we've extracted the DNA and RNA and prepared the libraries, the sequencer takes over. It runs the full analysis automatically. We don't interfere. We use our own servers, and when we purchase the necessary reagents, we gain access to 4 major global databases, both European and American. The process doesn't rely on manual review. An AI system scans the data, cross-checks it against global resources, and within a week, we receive a detailed report. It tells us exactly which mutation was found, how many copies are present, and which treatment options are recommended.
Genome sequencing allows us to predict life several years ahead. But most importantly, genetic testing is essential for those with a family history of cancer. While cancer itself is not inherited, all types of cancer have a common root: genetic mutations.
Причины, конечно, вот эта мутация этих раковых генов.
The causes of mutations in cancer-related genes vary: chronic illnesses, radiation, environmental toxins, ultraviolet exposure. Even excessive medical screening can contribute. Some patients feel it's not a proper year unless they've had multiple MRIs. That overexposure matters. Our own habits affect us too. Hot tea, strong coffee, alcohol, and smoking, all these everyday things can damage DNA. Chromosomes break. It's a normal process. But our bodies have repair systems. During the cell cycle, these mechanisms fix the damage, and the cell continues healthy. The problem begins when those repair systems wear down. There are so-called hotspots in our chromosomes, fragile zones where breaks happen more often. And if the cell can't keep up with the damage, that's when carcinogenesis starts.
Epigenetics is the science that studies how lifestyle and behavior impact a person's DNA, or more specifically, the activity of genes. Think of DNA as the piano keys, and epigenetics as the notes that tell us which keys to play and when. Interestingly, some of these changes can even be inherited. The way a pregnant woman eats and lives can affect the health of her children and even her grandchildren.
Мы сейчас рекомендуем новое такое тоже это.
We now recommend a new approach: preconception care. All pregnant women, as well as their husbands, should begin taking folic acid 3 months before the expected conception date.
В принципе, уже раздается местными исполнительными властями бесплатно, как бесплатно для пациентов.
This is already provided for free by local authorities. We ask all expectant mothers to take this, as it is preventive care for central nervous system defects, Down syndrome, heart defects, and facial clefts, including cleft lip and palate. By taking folic acid, pregnant women can significantly reduce the risk of these defects.
Принимать фолиевую, этих пороков может быть меньше.
Since every parent wants their child to be healthy, I believe we should never cut corners when it comes to health, not in terms of effort or time.
A geneticist is not a profession you can enter right after medical school. Doctors are trained through a residency program. That's why, alongside diagnostics, geneticists today also focus on training the next generation of specialists.
Гульшара Жусуповна – это была одна из причин, по которой я...
Gulshara Abildinova is one of the main reasons I chose this lab. She's an outstanding mentor, very knowledgeable, and has a wealth of experience. But she is also very strict and demanding.
Но она очень строгая, требовательная. Она требует и выходные, и вечера.
She expects us to work weekends, evenings, and every bit of free time we have.
Наукой, заняты генетикой и заняты работой, так скажем. Она очень сильно нам помогает.
We are always expected to stay focused on science, genetics, and our work.
И когда, например, приходится принимать очень сложные решения,
She's been a huge help, especially when it comes to new research. And when we face tough decisions based on patient test results or research findings, Gulshara Abildinova is decisive. We're really lucky in that sense. Whenever we're unsure, she takes charge and handles everything.
И решает все вопросы.
A medical geneticist is one of the most challenging and sought-after professions in modern medicine. These specialists work at the crossroads of genetics, biology, medicine, psychology, and even ethics. Not only do they identify diseases at the DNA level, but they also help families understand what the diagnosis means and how to manage it.